Have you been a bit concerned about the development of your child's spine? Maybe you or your child has been told they have a scoliosis. My name is Christian Flooded. Today let's talk a little bit about what is scoliosis and how you can check for it at home. So a funny story. I was wandering through a giant redwood forest the other day and I was looking at these trees and thinking, oh my goodness, they're so tall and so straight. Why don't trees like this end up with scoliosis? Well, I'm sure they actually do, but it would actually require the right kind of environment or things happening for them actually to develop this change in their normal straightness. It's the same with humans as well. There's often a reason as to why this may happen. See, scoliosis in its simplest terms is merely a sideways bend of our spine. It's not actually a diagnosis. It's a description of what we're seeing, this bend in our spine of greater than 10 degrees when measured on an X-ray. But it's a very complicated process. It's a complex process and there are many things involved with it. See, we can have infantile types that can be apparent shortly after birth. We can have juvenile, which is your 3 to 10-year-olds. We can have adolescent, which is the older kids as well. It can be a known cause, such as a congenital defect or a neuromuscular condition, or it could even be an unknown cause, and this is where we get the term idiopathic from. In fact, adolescent idiopathic scoliosis is the most common type that you're going to be finding, and we see this in about 0.2 to 0.6 of the general population. But if we look at just the females, this is actually 1 to 4% of the female population that can have this occur. So how does it come about? Well, there are a few theories in regards to the development of scoliosis. Some of these may be genetic. We might be looking at family history or family tendency to developing a scoliosis. There could be a hormonal component. In fact, leptin, melatonin, there are many hormones that have been associated with developing scoliosis. In fact, even the sympathetic nervous system, inflammatory things, balance, your vestibular system. This is what I mean. There are many different factors involved with the development of scoliosis. But what's important is actually identifying some of the risk factors for curve progression. Factors such as your gender. Being female, you are more likely to experience a curve progression. Your age, depending on the age of skeletal maturity, might make an influence as to where you're going to be developing. See, girls hit their pubescent growth spurt at around 11 to 12 years of age, meaning they're of a younger skeletal maturity, in contrast to boys who hit theirs at around 14 years of age. So they are a little bit more skeletally matured. So age could play a part of this one as well. And on the theme of puberty, menses have their period started. Girls who have had a curve present prior to the onset of their period are more likely to have a progressive curve as opposed to those who have had a curve develop after the onset of their periods. The type of curve can also play an important role. A single type of curve may not progress as likely as a double curve, and also the severity of the curve. Curves of greater than 30 degrees are more likely to continue to progress as that child gets older. So how can we check for scoliosis? First up is observations. We want to have a look at that child's spine, have a look from the back and see, are their shoulders level? Are their hips level? Are their ears holding level? These could be indicators of something being a little bit off center. Is their head directly over the line of their backside? Does their curve change between sitting and standing? In fact, this is an important one to look at, as it may indicate that there's actually a problem in their legs as opposed to a changing curve of their spine. So one of the most important tests we can do is one called the forward bending test, otherwise known as Adams test. With their feet slightly apart and legs relatively straight, we ask the child to curl themselves forward. I say to try and tuck your nose into your belly button and have a look at what's going on at the top of their spine. When they're leaning forward, is there any variation on either side? The left and the right, they should be level. What we want to look for, is there any rib humping? Is anything sticking out a little bit more? What can be useful at this point is just using a simple spirit level application, even on your phone. And according to the great Dr. Hugh Williamson, who presented a wonderful webinar run by the Royal Children's Hospital, if we're looking at an asymmetry of greater than 7 degrees, this is reason to have further examination and see if there's anything else possibly going on. So these are some simple things that you can do at home to help check your child for the development of any kind of scoliosis. If you're finding a bit of a curve, or if you're a bit concerned with any of the findings that you may have come across, please have a chat with your health professional and get them further examined. And as always, if you have any other questions, you can always ask Dr. Christian.